Hello and welcome to the Canada News with your host Tibera. Now let's take a look on the headlines. Mrs. Saga Mayor Bonnie Crombie welcomes lifting of outdoor restrictions. He said that this would enable people to participate in sports activities again. The Peel Region Chief Medical Officer said Brampton's positive rate this week was 12.7% and the number of patients in hospitals is also declining. Canada's Health Minister Patty Hajdu has claimed that the federal government has provided full support to the provinces and territories during the pandemic and shared all kind of information. Now news in detail. Mrs. Saga Mayor Bonnie Crombie welcomes lifting of outdoor restrictions. He said that this would enable people to participate in sports activities again. He thanked the Premier for this. The Mayor said that the 70% of the adults in Peel have received the first dose of their vaccination and will now take this figure to 75% by the end of this month.
I was so thankful and relieved that last week the province decided to lift restrictions on outdoor recreation, meaning that residents and families could finally play basketball, soccer, golf, tennis, baseball, pickleball, and cricket. And that they could finally make use of our BMX and skateboard parks, as well as our marinas. I want to thank the province for also adding spray pads and splash pads to the list of outdoor amenities that could open, as they weren't originally included. I heard from so many parents who told me that this was so important for them, especially with the warmer weather. The reality is that not everyone has a backyard where their children can cool off by running through the sprinkler. Many of our residents also don't have air conditioning. So this was a real equity issue for me, and along with the other mayors in the province. I strongly advocated for our spray pads and splash pads to open. I had the chance to test one of the water pumps at the spray pad at Jack Darling Park last Friday with the crew and with our great team at Parks and Recreation. And as soon as we turned on the taps, the kids flocked to the spray pad. It was really incredible to see what a magnet it was. I even ran through the water a few times myself. Adults, families, and children needed this. So thank you, Premier. Thank you sincerely to the province for allowing us to open up many of the outdoor recreational amenities. On the vaccine front, we've reached an incredible milestone here in the region of Peel. More than 1 million people have now received their first dose of the vaccine. That's close to 70% of our adult population, 18 plus. And we're on track to reaching our target of getting one dose to at least 75% of our adult population by the end of this month. That is absolutely fantastic news.
The Peel Region Chief Medical Officer said Brampton's positive rate this week was 12.7% and the number of patients in hospitals is also declining. And already admitted patients are being treated according to Dr. Law. Many people took part in outdoor activities and followed the instructions, who once again appeal to all get vaccinated and so that the pandemic can be prevented.
And thank you both certainly for your leadership and contributions. Thank you, Member Kira. I didn't realize that that Member Kira was vaccinating at our clinics here in Peel over the weekends, but we are grateful for that support in addition to the leadership provided by all of our leaders here in the region of Peel. This week, Brampton's test positivity sits at 12.7%. with a weekly incidence rate of 232.6 cases per 100,000, both down from last week. Our hospital picture is also slowly stabilizing, though admissions are still volatile, with numbers fluctuating daily. Local hospitals and ICUs still have many admitted patients, which is necessitating continued transfers and pauses on surgeries. And it's for this reason that I welcomed the gradual reopening approach announced by the provincial government last Thursday. I appreciated the caution that supports the goal of preventing any resurgence of COVID-19 and the flexibility to carefully revisit measures if indicators improve sooner than expected. It was good, indeed, to see many people outdoors in the past weekend, enjoying playground and activities while sticking to the precautions. That said, sticking to the precautions is still vital. The reality is that when and where cases surge, people will often need hospital care sooner than the current patients are healing and leaving the hospital. So it's important to continue limiting contact through masking and distancing and favoring the outdoors as much as possible. And where you can, please get vaccinated. On that note, our vaccination program continues to hit milestones here in the region of Peel. On Monday, we surpassed 1 million doses administered. Today, we are rapidly approaching 70% first dose coverage for 18 plus population. I anticipate that milestone to be confirmed today or in the days to come. And that also includes 75% first dose coverage for those aged 50 and over half of our 18 to 49 with first doses. The province's hotspot allocation has worked, and over the first 2 weeks of May, it has allowed us to advance our plan and bring our capacity online in very short order to get this hard-hit community vaccinated. That capacity delivered a record 170,000 doses in a single week last week.
Canada's Health Minister Patty Hajdu has claimed that the federal government has provided full support to the provinces and territories during the pandemic and shared all kinds of information. He also said that there was a lot in the report of Auditor General in this regard. Fulfilling them is the responsibility of Public Health Canada, for which work is being done.
And then I will say that it really wasn't just about the stock that was contained in the stockpile, but it was about the processes that the national stockpile were using to support provinces and territories. And early on in the pandemic, as we were trying to ascertain from provinces and territories what their anticipated needs would be, it became clear that we didn't have the information that we needed and that we needed to act quickly. And so working in collaboration with my colleague, Minister Anand, we began to put together an order for Canada based on what we estimated we would need to be able to support provinces and territories, and assumed essentially that we would need everything. And since then, we've come a long way, as the Auditor General's report has indicated, that we have now systems and structures that allow us to better inventory what we have and to better collaborate with provinces and territories in terms of anticipating what their needs might be, either in a particular threat or in an ongoing basis. And so I think the lessons learned have been that we needed, and we as you can see have taken many steps towards a much more robust system of really understanding what's in the nest, what the anticipated requirements or needs might be of provinces and territories, and ensuring that we have a very good and strong line of sight on how to get that product quickly. I think that that's the work of the Public Health Agency of Canada and the work they're undertaking right now. And again, it is really trying to understand what the basic equipment would be that would be required no matter what type of global health threat. You can imagine that the threat from a respiratory illness might require different equipment than the threat from another kind of illness, let's say a bloodborne illness. Nonetheless, there is some sort of standard equipment. I'm thinking of gloves, for example, and gowns and certain types of masks that would likely be required in a variety of different kinds of threats. And so that's the work of the Public Health Agency of Canada right now, is understanding how they manage that stock, what is a sufficient amount, and how we ensure that that stock is rotated so that we don't experience, for example, expiring stock without an appropriate use for that stock. And so, again, the Auditor General has provided very useful feedback, and the agency had already pursued some of those suggestions, obviously working through the last several months in a very urgent way. But nonetheless, the feedback from the Auditor General will fine-tune the work that the agency is undergoing right now.
The corona vaccine campaign in Toronto is in full swing. Information about the vaccination process: the Mayor of the Canada, John Tory, said that the corona vaccine has been provided to more than 2 million people in Toronto so far. He also said that the Toronto was the only area to receive more than 2 million vaccine shots.
Our Team Toronto effort has now administered more than 2 million COVID-19 vaccine doses in our city. We are the first local health region in all of Canada to administer more than 2 million doses. And this is great progress. And it comes just a day after we confirmed more than 65% of eligible Toronto adults have now been vaccinated, and we achieved that a week ahead of the provincial target. Thank you to everyone involved in our vaccination efforts: city staff, public health, hospitals, healthcare partners, community health centres, community organizations, pharmacists, doctors' offices. It's a lot of people that make up the Team Toronto that is putting these achievements on the board. Their tireless work has gotten us to this point, and we know that they're out there even today getting more and more people vaccinated. And thank you to everyone who has already stepped up to get their vaccine. It's a two-way process here. We need people to give the vaccinations and organize all that goes with that, and we need people to get them. Today, we will be talking about VaxTO, our plan to further ramp up vaccine outreach efforts and make sure that we reach absolutely everyone in our city to encourage them to get vaccinated. Before I talk a little bit about that, and it'll be expanded upon by Councillor Joe Cressy, the Chair of the Board of Health, who has had much to do with this VaxTO program, I want to just acknowledge this is Toronto Paramedic Services Week. Paramedic Services Week is a time to honor the challenging work and the responsibilities that paramedics have day in and day out in homes and in hospitals and right across the city. And of course, the paramedics that are in our service in the City of Toronto have performed extraordinary service during the course of the pandemic on the front lines every single day. Their commitment has helped us to navigate through these unprecedented times, and as we move forward, they are going to continue to be vital to our efforts in reaching all corners of the city. They've helped us in the clinics, for example. They've helped us with reaching people who are homebound. They've done a lot of things that have helped us with our overall efforts, and I want to say
Toronto Medical Officer Dr. Alan Dibla reports that 353 cases have been reported in Toronto, 942 patients admitted to hospitals, 255 are critically ill patients undergoing toxic treatment in ICU. He also confirmed the deaths of 7 other patients with the coronavirus. However, Dr. Dibla said that the number of corona cases in Toronto has been steadily declining and situation is improving.
Today, I am reporting 353 new cases of COVID-19. 942 people are in hospital and 255 people are in the ICU. I'm saddened to report 7 deaths today. Overall, the measures of illness are in decline, which means our situation is improving. Vaccination is vital to sustaining the downward trends in these figures. There are 2 things, though, that are important to touch on today, both relating to vaccines and vaccinations. The first is to restate that if you are offered a Moderna vaccine, you can accept it with confidence. It provides a high level of protection against COVID-19. Every vaccine available to Canadians undergoes careful evaluation and review and is monitored constantly after approval for use. Moderna and Pfizer are very similar vaccines, and based on clinical studies, after completing the vaccination series, Health Canada describes them both as highly effective in preventing COVID-19. We know the vast majority of Torontonians support vaccination. If that's not you, let's get to the bottom of why. Because we absolutely need as many people as possible to join the ranks of the vaccinated. In that respect, I want to flag that currently, around 28% of people aged 80 and over still have not had a first dose of vaccine.
Brampton Mayor Patrick Brown discussed outdoor activities, nothing that the provincial government had been asked to ease restrictions inside Brampton, which was accepted by the government. He also said that the golf courses, the sports complexes and shopping places would be open this weekend.
I want to start off by speaking about outdoor amenities. I wanted to highlight that I was grateful that the province listened to our request to lift some of the restrictions that were among the most onerous in North America. And as of this weekend, we were permitted to open up our golf courses, driving ranges, soccer and other sports field, tennis, basketball course, lawn bowling, bocce, BMX and skate parks. I would note that team sports are still closed and outdoor pools are closed. So this is positive that they lifted some of the restrictions. I would love to see more of these outdoor restrictions lifted, given the fact that that has been the clear medical advice from the Ontario Science Table, but progress is good, and it was great to see these facilities so widely used this past weekend. We had all our facilities immediately opened once we were given the provincial go-ahead, and I can tell you that they were widely used because people want to be outdoors. They want to get fresh air, and so that was wonderful to see, including the last-minute correction by the province to open splash pads. With the warm weather, it just was a no-brainer, and so thank you to the provincial government to listening to that call from municipal leaders across the province, and hopefully we'll see the other restrictions on outdoor amenities lifted as well. In terms of vaccines, we've also had some great news in Peel Region. We have now passed a very impressive milestone, over 1 million doses administered across Peel. And we are rapidly approaching our interim goal of 75% of adults vaccinated over the age of 18. Currently, we sit almost at 70%. I think it's closer to 69%, but those are big numbers. And vaccines paved the way to getting back to normal. And so when you see numbers like this...
Brampton West MP Kamal Khera spoke about the corona vaccine campaign in Canada, saying that over the past week, 60% of the Canadians over the age of 16 have received their first dose of the vaccine. He also said that the more than 1 million people in the Peel region have been vaccinated.
Let me start off by sharing an important milestone that deserves to be acknowledged and celebrated. And that is that as of this past weekend, more than 60% of Canadians over the age of 16 have received at least one dose of a vaccine. Another significant milestone in our community is that over 1 million first doses have been administered in the region of Peel. And I just want to take a moment just to thank all the people who have made this milestone possible and made it a reality. From governments working together, from our federal government, who's procured over 25 million doses so far, to Peel Public Health, to our hospital partners, to healthcare professionals, pharmacists, nurses, doctors administering vaccines, and to community leaders and volunteers that are stepping up. It is because of your hard work and your dedication that has made Canada a leader in vaccinations on the international stage and third most vaccinated country in the G20. Moving forward, Canada will continue to receive millions of vaccines every week, and by the end of the summer, every single Canadian who wants a vaccine will be able to get one. As Mayor has mentioned, as a proud registered nurse myself, I've been spending my weekends at clinics in Brampton vaccinating community members. And I have to tell you, it has been so inspiring to see so many Brampton residents doing the right thing, stepping up and getting vaccinated. So to all of you that have gotten your vaccine, thank you for doing your part in keeping our community protected in the fight against COVID-19. What's even more exciting is that over the weekend, we started to vaccinate youth aged 12 and older. And I can't tell you how inspiring it has been to see young Canadians in our community stepping up to book their vaccine and proudly taking their shot. So if you're over the age of 12 and up, you can book your appointment, as the Mayor has said, do your part, get your shot. It is easy, quick, and it will get us that much closer to beating COVID-19.
NDP leader Jagmeet Singh discussed the Government of Canada's proposed $800 million reduction in Canada recovery benefit for July and August and an increase in bank fees. We are still facing a terrible pandemic, he said. Things are still not easy for us in such a situation. People cannot be deprived of benefit recovery.
I wanted to start off two things I want to share with you. First off is we are still in the middle of the pandemic. Things are still very volatile. We see numbers increasing and a situation developing in Manitoba that is really worrying. We're seeing people having to be sent to Ontario because the ICU units in Manitoba are being overrun. Things are bad, and we know that there are going to be continued risks and fears until we all get vaccinated. Despite the fact that there are still millions of Canadians that cannot go back to work, their sectors are still shut down, there are over 2 million Canadians that are still, or almost 2 million Canadians that are still using the CRB. The Liberal government is going to cut the help that these families receive by $800 a month for July and August. That is absurd. And what should happen is people should continue to receive help until we are fully reopened and people can go back to work and go back to their sectors. The fact that Justin Trudeau is cutting help to these people who are amongst the most desperate, the people who cannot go back to work, whose sectors continue to be closed, and we know there's many sectors that are still shut down. That's nearly 2 million Canadians that are going to be infected by the Liberals' decision to cut help to these people by $800 a month. And so we are fighting to stop that cut, as we have throughout the pandemic, fighting to keep help going for people that need it, and we're going to continue to use the tools we have to fight for that. The second thing I want to talk about again is the fact that in this pandemic, it is very clear that people have suffered. People have been hard hit by this, but big banks haven't been. In fact, big banks have posted profits, and some of them have posted record profits. They've made billions of dollars. They took public money, they made billions of dollars of profit, and now on top of it all, they are increasing bank fees in the midst of a pandemic.
So that's all we have in this edition. Thanks for watching. Stay tuned for more updated news.